Hi, I'm Dr. Alexander Sinclair. I'm a board-certified plastic surgeon. We're talking about breast augmentation. Breast augmentation is a surgery where an implant is placed to change the size or shape of the breasts. A breast augmentation consultation generally lasts about 45 minutes. There's a lot to talk about. I'm going to condense the topic and give you the crux of the choices that you will have to make prior to your breast augmentation surgery. There are 4 incisions that can be used for breast augmentation: belly button, underarm, inframammary crease, or nipple. They're all acceptable incisions. They have advantages and disadvantages. The choice of the incision is best discussed with the doctor to determine which one is right for you. Implants are either saline or silicone. The difference between the two is the material that's inside the implant. Saline is salt water. Silicone is a gel. Both products are safe. Silicone is generally regarded to have the more natural result. Again, this choice will be discussed with you and your physician, and you will make an appropriate choice about whether saline or silicone is right for you. The choice that patients often have difficulty making is choosing a size. Most patients have done some kind of research and they have friends that have had the surgery. They ask their friends, what size do you have? And the common talk is cc's. cc's is a measurement of breast size. To be clear, 28 cc's equals an ounce. So someone with a 280 cc implant has 10 ounces of fluid in the implant. But that's not really the most important thing. The most important thing is the shape of the breasts. And now we're talking about profiles. And there are many different types of breast implant profiles. To make this easy, think of either a flat pancake or a round melon. Those are two very different shapes. So I have a really large implant here. It's 800 cc's, but notice how flat it is. I'm taking a much smaller implant. It's half the size, yet it actually projects more. By projecting more, I mean it comes more forward. That means that this implant will actually have a larger cup size. It'll be fuller on top. So the idea of choosing the right profile is critical to getting what you want. A full discussion with your physician should occur so you can make the right choice, not just choosing 300 or 400 cc's, but understanding and knowing the difference between a low, moderate, high, and full projecting implant. The other thing you have to think about and then ultimately choose is whether you want a smooth implant like this one or a textured implant like the one in my left hand. The difference is the surface, and the surface can influence the amount of softness and position of the implant. This choice again will be determined by the discussion between you and your physician. There's one more choice that's important. Both of these are round implants. When you look at them, you see that they're round. When I hold them up, you'll see that they do contour. The bottom pole, the inferior pole, becomes more full, and the superior pole flattens out a little bit. This gives a natural breast shape. There is another implant, commonly called a gummy bear implant, that has that type of structure built into the implant, so that in all positions, the shape will be maintained. So this implant, the anatomical gummy bear, will have some consequences in terms of incision and placement. Again, a full discussion with your doctor will enable you to make the right choices for yourself.